various triggers for urinary tract infections. And if it is an infection, the bacteria is usually associated with the anus and the gastrointestinal tract. And most oftenly, it's E. coli bacteria. And this is why the length of the urethra is important, because it may infect the urethra. So the bacteria travels somehow from the anus or the GI tract to the urethra and then travels up. So if we have a look back at our diagrams, we'll see with the man, it's got quite a long way to go up before it hits the bladder. With the woman, it's not so far up before it hits the bladder. So cystitis certainly is more common in women, possibly for that reason. In terms of how that happens, it's really unclear, and we'll talk about bacteria and infections in a while and different theories of that. But there are a lot of theories about, certainly in some cases, in terms of hygiene. So going to the loo, wiping your bottom, but wiping it in a way where the anus bacteria can affect the urethra, which is much more likely to happen with women than with men because of the way that men go for a wee. It's very far distant from their anus, whereas with women it's much closer. So purely from a structural point of view, that's a possible reason, or one of the possible reasons why women may be more prone to cystitis and UTIs generally. And you'll see here, it's not just E. coli. 10 to 15 cases of UTIs are a staph infection, especially with younger women. And with older women, sometimes it's Klebsiella, Enterococci, or Proteus mirabilis. So there